Hello, my name is Fraser Edwards. I work for Research in Motion, the maker of the Blackberry smartphone, and my role is market development for the healthcare segment. Today, smartphones, and BlackBerry specifically in the hospitals, are being used, I would say, for medical reference, for access to information on the move, and increasingly are beginning to be used for alerting and other collaboration aspects. They basically bring together the communication doctors need with the information and increasingly access to the health record in the back-end systems. BlackBerry smartphones have always come from the perspective of the business need or the organization's need. So what sets them apart in the healthcare context is really when they're implemented in conjunction with BlackBerry Enterprise Server. And this is a piece of back-end server software that can basically manage some of the key issues around privacy and application deployment. So what sets BlackBerry apart is really a secure platform on which applications, communications, and information can be shared that contains personal health information. So access to electronic health information is definitely a journey that a lot of organizations are going on at the moment. And I would define it as two sides to that. One would be when you're pushing content, maybe from a lab system, out to a smartphone. And there's a whole bunch of examples of organizations that have replaced pagers and some of the voice over IP phones or the house phones that are in place at the moment, and are using the smartphone as a way of sending that information so physicians and nurses and other auxiliary staff can see more than that there is a page. They can actually see the clinical content. So they can see the x-ray, they can see the lab result. They will then do something with that and collaborate with their colleagues, or maybe go to a computer on wheels to see more information in maybe greater detail if it's an x-ray and they need to look at it in high definition. But then the other piece is if they need more information. So other cases when they're working with a McKesson system or Siemens or some of the other hospital information systems, there are mobile applications largely based on the web browser where you can go into the patient census and you can pull down that additional content that you need to make a fully informed decision about your patients. I would say we talk a lot about clinical collaboration, which is this idea of sending information, pushing content to clinical workers, helping them collaborate with unified communications tools, and then access to further health record. I would say that's still in very early stage of adoption. Places like the University of Pittsburgh Medical Center are rolling it out as we speak. But I think for most physicians, the smartphone is still that means by which they maybe communicate with their kids. They're using the Hippocrates drug reference or Lexicomp or some of those other tools, but they're not really using it for kind of deep patient-centric issues. So I think it's definitely cutting edge in a few centers today. However, a lot of physicians have adopted the smartphone, so they have the device in their hand. What's still needing to happen is the implementation of those deeper solutions that gives them the content they need about their real patients. I think historically what's happened, going back to early PDAs in the healthcare space, is the focus was always trying to squeeze the desktop, what you saw on your 19-inch monitor, down into a 2-inch PDA or eventually smartphone screen. And I think it just doesn't work. So I think why there's been a delay in rolling this out is, firstly, there's been a delay overall in adoption of health records universally. But more so, it's what are you trying to get that smartphone to be, or what are you trying to get that smartphone to do for you? And our strong belief after working in this space for a number of years now is that is related to the workflow. That is related to the communication, the collaboration. So it's not trying to squeeze all that health data down onto a small screen. It's giving the pertinent data that you need in the context of your patient. So send the alert with the result, help the physician communicate with the rest of their care team, maybe over a voice over IP call or instant message, and then give them maybe the medications they need. So really that clinical collaboration is a subset of the wider EMR usage. So one of the centers that's really, I guess, leading the charge in terms of using smartphones in this deeper context, this idea of clinical collaboration, would be UPMC in Pittsburgh. They have their Center for Connected Medicine that is really driving the vision of what should happen, and then within the actual hospital sites and within the clinical users, they're driving this into reality. So two sides to that. One would be on the physician side, where they took an application called DB Motion that gave an aggregated view of the multiple health record systems that they use in that center. I think they have several hundred different, or probably more so, back-end systems that houses the data. DB Motion aggregates this together and gives the physician that mobile view of pertinent information about the patient they're dealing with right now. On the flip side, then they're also rolling out to their nursing staff. So they're using some voice over IP solutions, they're using text messaging and kind of alarms and notifications coming from the bedside to enable the nurses to be more efficient with their time. So they're really allowing the nurses to collaborate with the physicians to get approvals, to discuss what's going on with their patients, and also into the area of transporters. So if the patient's not ready, they can delay people for 15 minutes. If they need someone pick it up right now, they can bring them forward. So the smartphone in some ways is really becoming that workflow tool that's bringing all the pieces of technology that are there today together into a single form factor that they can take advantage of to really change how they deliver care and make it a lot more about the patient, because there's a lot more time by the savings the smartphone platform has given them. The patient piece, I think, is also very interesting, and our opinion is it's going to be driven so much by the consumer and what they want. So at one end of the spectrum, I maybe want to exercise more, and this is much more in a wellness context. I want to eat more effectively, better choices for lunch. And you're seeing a whole bunch of applications come in that space, from different weight management tools through to people like Adidas, who have just launched the My Coach application, that are helping you be more effective in how you're training and trying to stay on top of I guess your general health. But progress it a little bit further, at the other end of the spectrum, you have people with multiple chronic diseases, and diabetes is the one that's discussed frequently because of its prevalence across North America. And there you're taking the smartphone in the context of being basically the two-way messaging tool. We can pull information from a patient through Bluetooth-enabled monitors. We can take their glucose. We can track in real time what's going on with them, but share that information maybe to a nursing station. So WeCare is one of our local providers in the province of Ontario, where I am based, and they are taking a program that they're offering out to their customers, their patients, to manage hypertension and diabetes. And they're using these tools to actively work alongside the patient to manage their chronic condition.